Freedman, and I'm here with Jenny Mullen, and we're both excited to speak with you all about the important contribution that immunization makes to family child care, excuse me, and some of the resources you can use in your work. Let's see if I can get this slide to advance. Sorry, I'm just having a little issue with my slides. Here we go. All right, so first off, just wanted to say neither Jenny or I have any financial relationships to disclose. Next are the learning objectives. After participating in this webinar, participants should be able to describe vaccine-preventable diseases that commonly occur in childcare settings, describe ways that they can promote immunization within their family childcare programs, and identify free CDC resources to share with parents. As you all know, a child's early years are very important for his or her childhood growth and development. A child will achieve multiple milestones in his or her first year of life: social and emotional, language and communication, cognitive milestones like learning and problem solving, and movement and physical development. A child's health can impact his or her physical development. Immunization is a critical component of early childhood development. When children are healthy, they can stay on track with meeting their developmental milestones. It is also important to recognize that health and safety practices, including immunization, are the foundation of quality child care settings. I'd like to just briefly go over the importance of immunization for early childhood development. Immunizations are a key factor in a child's health. Immunizations can provide protection from serious illnesses during early years and beyond. Immunizations can prevent outbreaks of measles, flu, and pertussis, or whooping cough, in early childhood settings. And lastly, school readiness begins with good health. The CDC recommended immunization schedule protects children 0 to 6 years old from 14 vaccine-preventable diseases, which are listed here. The schedule is designed the way it is to provide protection early in life, before children are exposed to potentially life-threatening diseases. The CDC schedule is officially endorsed by the American Academy of Pediatrics and the American Academy of Family Physicians. Over the years, CDC's audience research has revealed that many parents aren't aware of some diseases that can be prevented by vaccines. For example, Haemophilus influenza, or HIB, or pneumococcal disease. Also, parents may be aware of diseases but don't appreciate how serious they can be. For example, chickenpox or flu can have some pretty serious complications. Next, I'm going to talk about 3 diseases that can spread easily in child care settings: measles, flu, and whooping cough. Measles is a respiratory disease caused by a virus. You may think of a red rash when you think of measles, but there are other symptoms, including high fever, cough, runny nose, red and watery eyes, and tiny white spots inside the mouth. It's especially important for child care centers to be aware of measles because it is one of the most contagious diseases, meaning that it spreads very easily when people cough or sneeze. People who are infected can spread measles 4 days before they get the typical rash, through 4 days after the rash appears. A child can get measles just by being in a room where a person with measles has been, even up to 2 hours after that person has left. Measles is more serious in children under 5 and adults over 20 years old. Measles is very common in other countries, and outbreaks have also happened in the United States in recent years. Millions of people worldwide get measles each year, and thousands still die from it. Measles can be serious, as I said earlier. About 1 in 4 people who get measles will be hospitalized. 1 out of every 1,000 people with measles will develop brain swelling due to infection, otherwise known as encephalitis, which can lead to brain damage. 1 or 2 out of every 1,000 people with measles will die, even with the best care. So who should be vaccinated for measles? CDC recommends that children receive 2 doses of MMR vaccine, which prevents measles, mumps, and rubella. They need the first dose at 12 through 15 months of age, and the second dose at 4 to 6 years of age. The vaccine is very effective. 2 doses of MMR vaccine are 97% effective at protecting against measles. The vaccine doesn't just protect babies and young children who receive it, it also protects other babies around them who can't be vaccinated because either they are too young or they may have weakened immune systems. Next, let's talk about influenza or the flu. Flu is another respiratory disease that spreads very easily. It is different, however, from a cold. Flu spreads most often by droplets from coughing or sneezing, and this picture really demonstrates how much droplets are produced during a sneeze. Flu symptoms can usually come on suddenly. They include fever, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, and tiredness. Some people, especially children, may also have vomiting and diarrhea. This past flu season here in the United States was very severe. As of last week, we know of 174 children that had died from complications from the flu. Flu can have a bigger impact on your child care than you might imagine. Anyone, even healthy people, can get the flu. Serious problems related to the flu can happen at any age. Some people are at risk of developing serious complications from flu. Young children are one of these groups. Other people at risk of complications include people 65 years and older, people with chronic medical conditions, and pregnant women. This slide demonstrates the health impacts of the flu. Each year, millions of children get sick with seasonal flu. Thousands are hospitalized and some children die. It's important for childcare workers to be aware of this because children younger than 5 years, and especially those younger than 2 years old, are more likely to end up in the hospital from the flu. And as I mentioned, 174 children died in the US during the 2017 and 2018 flu season, so this was a particularly severe season. So who should be vaccinated against the flu? A yearly flu vaccine is the first and most important step in protecting against flu viruses. Everyone 6 months and older should be immunized against the flu every year. The nasal spray is an available alternative for the 2018-2019 or upcoming flu season for children and adults 2 years through 49 years. Women who are pregnant during the flu season should also get a flu shot. Women can get the flu shot at any time during any trimester while they are pregnant. However, the nasal spray is not recommended for pregnant women. Childcare workers should also be vaccinated to avoid spreading flu to babies and young children. Getting vaccinated before flu activity begins, if possible by October, helps protect you once flu season starts in your community. However, CDC recommends flu vaccination as long as flu virus is circulating, even into January or later in some flu seasons. Next, I'll talk about whooping cough or pertussis. Whooping cough is another respiratory disease that spreads very easily. It is the most dangerous for babies. Most whooping cough deaths occur in early infancy when babies are just a few months old or younger. Many babies can catch whooping cough from their close family members. They could also potentially catch it from other caregivers like child care center workers who are in close contact with the baby. Early symptoms include those that are listed here, such as runny nose, mild occasional cough, apnea or pause in their breathing, especially in babies. Later symptoms include fits of rapid coughs followed by a high-pitched whoop and vomiting during or after the coughing fits. Whooping cough has been on the rise in the United States in the past several years, and there's a number of different explanations for that. So who should be vaccinated for whooping cough? Whooping cough vaccine is recommended for many age groups. Infants and children need 5 doses of the diphtheria, tetanus, and acellular pertussis, or DTaP vaccine at 2 months, 4 months, 6 months, 15 to 18 months, and 4 to 6 years. Adolescents, adults, and pregnant women who also need the Tdap vaccine, which is designed for that population versus babies. In some states, childcare workers are required to be vaccinated against whooping cough. Even if this is not required by state regulations, It's a good idea for childcare workers to receive Tdap vaccine, especially if they care for very young babies. It is also important to note that vaccinating women during each pregnancy is the best way to prevent pertussis in infants before they are old enough to get their own vaccines. The recommended time for vaccination for pregnant women is the 27th through 36th week of pregnancy. You may serve families with multiple children in which the mother is pregnant. You can help ensure that her children are protected against whooping cough by reminding her about getting the vaccine. Outbreaks of vaccine-preventable diseases have occurred in childcare centers. In recent years, there have been outbreaks of measles and whooping cough, which we discussed, and also of chickenpox. The screenshot here shows a recent outbreak of measles in Johnson County, Kansas, which started in a childcare center. Unvaccinated children in your childcare center or home are at risk of getting disease if they are not vaccinated. This includes babies that are too young for vaccination and also children who cannot be vaccinated due to medical conditions. Children who are not caught up on their vaccinations may be excluded from childcare if there are outbreaks in a childcare setting. Now I'm going to hand this over to Jenny, and she's going to discuss ways childcare providers can help support immunizations.
Thank you, Mark. This is Jenny Mullen. I'm so happy to be with you guys today. I'm just going to go ahead and share my slides. So hopefully now everybody sees a slide that says 3 ways family childcare providers can support immunization. So as Mark mentioned, making sure that children are immunized according to the CDC's recommended immunization schedule is really the best way to ensure that they are protected from 14 very serious diseases. The recommended schedule provides immunity early in life before babies are exposed to these potentially life-threatening diseases. Each vaccine is tested during the licensing process to ensure that it's safe and effective for children to receive at the recommended ages. When children get behind schedule for one reason or another, this puts them at risk of becoming ill with a disease during that time that they're unprotected with the vaccine. So making immunization a priority in the early child care setting really is critical. It's about fostering an environment that promotes health. And today I'm going to talk with you about 3 ways to do this. One is checking immunization records to make sure each child is up to date on their vaccinations. 2, educating yourself and any staff that you may have about immunizations and ensuring that you and your staff are vaccinated yourselves. And 3 is educating parents in your programs and connecting them with credible resources. So let's talk about checking immunization records. You can ensure that the program is aware of which children are up to date and those that are due for immunization. Checking immunization records is an ongoing process. As children are enrolled in the program, check their vaccine records against the recommended immunization schedule. And I know the URL is somewhat long, but the URL is listed here on this slide. So you can use this to check records against the schedule. You may want to refer back to this slide later to get the URL. So check their records against the schedule to see if they have received all the recommended vaccine doses. Then, as children get older, check their vaccine records again on a regular basis to make sure that they're staying up to date. It may be helpful to set a regular schedule for reviewing immunization records of all the children, for example, on a quarterly basis. If you determine that a child may be behind on her vaccines, ask the parent to make an appointment with the child's healthcare provider as soon as possible to get caught up. Parents should request a vaccine record from their doctor as official proof of vaccination to show you, and they should keep this record in a safe place. It can also be helpful for parents to track shots themselves in order to see what's coming up and what shots their child may be missing. They can then discuss upcoming or missing shots with their child's doctor. This slide shows a tool that parents can print out from the CDC website and use it to record and track both their child's immunizations and their developmental milestones. Your state immunization program or doctors in the community may have other versions of immunization trackers that they hand out, and those are also a perfectly good option to use as well. All doses of the recommended vaccines are needed for the best protection possible against these diseases, and that includes the third and fourth doses of vaccines. But we do know from our immunization surveys that many parents find it challenging to get these final doses of some vaccines. By encouraging parents to get these final doses, you can help ensure that children are fully immunized. As children get older, different vaccines are recommended at different ages, and you can help ensure that parents are aware of these as well. Immunization information systems, also known as IIS or immunization registries, can help make tracking immunizations much easier. IISs are confidential, computerized databases that record all the immunization doses administered by participating medical providers. So in other words, what that means is that when a healthcare provider, like a nurse, gives a vaccine to a child, they enter that information into their state IIS. Every state has an IIS, except for New Hampshire, but theirs is actually currently under development. The IIS is probably the best way to get the most accurate, up-to-date immunization information for a given child. You will likely find it far easier and faster to just look up the immunization records through your state's IIS rather than go through the process of reaching out to parents to get this information. In some states, child care providers may be able to access the IIS to see which immunizations children have already gotten. And parents can also ask their child's doctor for immunization records. You can contact your state or your local health department to learn how to access your state's IIS. And your state immunization program or your state immunization coalition may be able to provide training on using the IIS. Let's move on now to talk about the importance of educating yourself and any staff that you may have about immunization. I encourage you and your staff to become educated about vaccines. You don't have to become an expert on the topic, but it's helpful to have some basic knowledge. For example, I encourage you to learn about vaccine-preventable diseases, including symptoms, what to do if a child gets a vaccine-preventable disease. For example, some diseases like measles and whooping cough are notifiable, meaning that you must report them to the health department. There may also be special procedures you need to follow in case of a disease outbreak. Your state or local health department can provide you with that guidance. Excuse me. I also encourage you to learn about vaccine requirements in your state. CDC's recommended vaccine schedule, which may include more vaccines than those that are required in your state, and common questions that parents have about vaccines, as well as vaccines that are recommended for you and any staff that you may have. This may seem overwhelming, but there are really just a few key things that are the most important things to tell parents. And these are, first of all, look into your state's child care vaccination requirements. Also, tell parents that vaccines protect infants and children from 14 serious diseases. Also, vaccines protect their children, and they also protect other children in the child care program. For example, some children are too young to be protected with immunization, or they cannot be vaccinated due to medical conditions such as cancer, and vaccines help protect those babies too. Also, share with parents that the Vaccines for Children program provides eligible children with vaccines at low or no cost. And I'll talk a little bit more about the Vaccines for Children program shortly. CDC has materials to help you learn about many of these topics that I just mentioned. Reading these materials ahead of time may help you feel more comfortable discussing the importance of following the immunization schedule when you talk with parents. A great place to start learning about childhood vaccines is the CDC's vaccine website for parents. This website is a one-stop shop for information about the immunization schedule, vaccine-preventable diseases, how to prepare for a vaccine doctor's office visit, records and requirements, and a lot more. It's also a great place to find resources you can share with parents, like infographics, videos, posters, and listicles, and I'll talk more about these resources in just a moment. There are also additional ways that you can learn about immunization. You can contact your local or state immunization coalition or health department to see if they provide in-person training to child care providers. Many state-level coalitions and health departments organize annual immunization conferences, and those may be helpful to attend. If you're a clinician, you can take advantage of CDC's free online trainings for healthcare professionals. We offer a variety of trainings that are available on demand or live, and many of them do offer CE credit as well. And you can refer to websites of other credible organizations like AAP, which is the American Academy of Pediatrics, the Children's Hospital of Philadelphia's Vaccine Education Center, or Vaccinate Your Family. And these are also good resources to share with parents, especially those who may not trust the CDC. So earlier I mentioned the Vaccines for Children program, and I wanted to spend just a minute talking a little bit more about this to tell you about it. The VFC program is a federal program managed by CDC that provides vaccines at no cost for children age 18 and younger who meet certain criteria, which are listed here on this slide. If a family gets vaccines through the VFC program, the vaccines themselves are free, but families may still be asked to pay a fee for the office visit. There are 44,000 VFC providers nationwide, and these include private doctors, private clinics, hospitals, public health clinics, community health clinics, and schools. If families fall into one of the categories on this slide, they can ask their providers if they participate in VFC. While CDC does not have a national online VFC locator, many state health departments do have online locators that parents can use. If your state does not have an online locator, you can call your state's immunization program manager to get a list of VFC providers. And the link on this slide will give you the contact information for those state immunization program managers that can provide the list. One of the most important things you can do is to make sure that you and any staff you have get vaccinated to protect yourselves and to avoid spreading diseases to children. You can find out what vaccines they may need by taking CDC's adult vaccine quiz. And the URL for that is listed here on this slide as well. Some states also require that child care workers be vaccinated against certain diseases. So for example, California passed a law in 2015 that requires child care workers to be vaccinated against flu, measles, and whooping cough. And Rhode Island requires child care workers to be vaccinated against flu, measles, whooping cough, and chickenpox. Now finally, let's talk about how you can educate parents about immunization and connect them with credible resources. And I think we all know that there is a lot of information out there online about childhood vaccines, and unfortunately, not all of it is accurate information. You can encourage parents to seek information from credible sources. As I mentioned earlier, CDC, the American Academy of Pediatrics, the Children's Hospital of Philadelphia, and Vaccinate Your Family are all credible websites you can feel comfortable recommending to parents. And here are some other ideas about how to share credible information with parents. You could put CDC immunization schedules and fact sheets into new parent packets, hang posters and print ads in places where parents can see them, share CDC immunization articles and emails you send to parents. And we have articles on our website you can simply copy and paste or copy and edit before you send them. Put a CDC web button on your website, and this will point parents directly to CDC's vaccine website for parents. And you can also share materials and immunization messages through Facebook and Twitter. And we have on our website sample posts and tweets that you can easily copy and use, or you can use them as a starting point and edit them to put in your own voice before you use them, but please feel free to use those resources in your own account. This slide shows CDC childhood immunization resources that can be shared with parents through email, websites, or social media channels. And we have lots of materials. We have fact sheets, infographics, listicles, and really a lot more. CDC also has fact sheets on vaccine-preventable diseases and vaccine safety that you can download and copy for parents. And to get these, you can simply visit this URL on the slide. CDC also has resources available in Spanish, including disease fact sheets, a listicle, and an infographic, and you can find those at the link on this slide. As I mentioned earlier, it's a good idea for you and your staff to be familiar with common questions that parents ask about vaccines. Here's a screenshot of CDC's frequently asked questions about infant immunizations. A few examples of questions that are covered include, are vaccines safe? Can vaccines overload my baby's immune system? And what's wrong with delaying my baby's vaccines if I'm planning to get them all eventually? These fact sheets are written for parents of children ages 0 to 2 years old, and CDC developed them together with the American Academy of Pediatrics and the American Academy of Family Physicians. They're available in English and Spanish, and you can either view them online or download a PDF to print off copies, and you can link to this page from your website. I also encourage you to review the CDC immunization schedules, which are updated every year and endorsed by the American Academy of Pediatrics and the American Academy of Family Physicians. CDC has easy-to-read versions of the schedules in both English and Spanish. CDC also has a new online quiz that parents can take to find out which vaccines their child may need. It provides information for children ages birth through 18 years of age, and it's a really nice resource that you can promote to parents as they enter your child care program. Another good resource is CDC's 60-page Parents Guide to Childhood Immunizations. You can order up to 25 hard copies for free and distribute them, or you can also encourage parents to order a copy themselves. This slide gives you the step-by-step instructions for ordering any of the free materials that CDC has available. I'm not going to go through these steps in detail now, but I just wanted you to know that this slide is included so you can refer to it later when you place an order. Educating parents about the importance of immunization as soon as they enter your child care is a great idea. But there's also specific times of the year when CDC has special immunization observances. And these provide another opportunity to educate parents and encourage vaccination. They include National Infant Immunization Week, or NIIW, which is in late April, and National Immunization Awareness Month, or NIAM, which is in August. That's really just right around the corner. And we hope that as NIAM approaches, that you'll be able to use some of the resources that I just shared with you in the coming weeks. And you can find out more about these observances by visiting the websites listed here on this slide. So to summarize what we've discussed today, immunization is a key component of early childhood development. It's very important for family child care providers to make immunization a priority and foster an environment of health by tracking immunizations, educating staff, and educating parents. And there are many ways that you can educate parents using the resources from CDC and other credible organizations. And that's the end of our formal presentation. I did want to thank everyone so much for your time and your attention today. Dr. Freedman and I would be happy to take your questions at this time. As Nicole mentioned earlier, please feel free to submit your questions in writing through the webinar platform, and we will answer as many this evening as we can, and we may follow up separately with people individually over email to answer those questions we can't get to tonight. And I'm going to go ahead and actually just flip to the next slide. So you have available on the screen the contact information for both Dr. Freedman and myself, in case you'd like to jot that down if you'd like to follow up with us later. And I'll pause now and give people a chance to enter questions into the questions field.
Hi, so this is Dr. Freedman again. I was just looking through some of the questions that we've already received. And the first two are sort of similar. One, will you be able to get a copy of these slides? And two, where can they get access to all these resources? And so you will have a copy of the slides after the presentation, and all the information that Jenny talked about with links will be in the slides. So you should be getting those. There was another question, which was basically which months are considered flu season. And so flu season is generally considered from about October of each year through around March, April, so through the colder winter months and early spring. Sometimes we can see flu pop up at other times of the year. For example, the H1N1 outbreak back in, don't quote me on the year, a few years back, that actually peaked in the spring and the summer. But typically here in the Northern Hemisphere, we'll see this October through about April. And we do recommend that you get your vaccines at the beginning of the flu season. So as soon as a vaccine is available, and sometimes that's as early as August, September, but usually it's around by October, and so start vaccinating right around then. Let's see what else we have here. There's a question here. Oh, go ahead, Jenny.
No, it's okay. Why don't you take another question and I'll jump in after you.
Okay, so I was just reading one. There's a question here about hand, foot, and mouth disease, or Coxsackie virus, and which is, also another contagious condition that's often seen in childcare settings, and question about whether a vaccine will be developed for that. And I don't have that information now, but I will get to that. I will try and find some answers for that, and we'll be able to send an answer out to all of you once I have that information.
Wonderful. Well, this is Jenny Mullen, just jumping in here, looking at some of the questions that are coming in. I see a couple of questions asking about the URLs for some of the resources that I shared, including the ordering instructions. And I guess I wanted to say too, I should have mentioned at the beginning of my portion of the presentation, you probably noticed that I have quite a few URLs in my slides. And that's because I was trying to make sure that people could go directly to the right page in our very large website to find the exact resources that we were highlighting for you. So I would recommend referring back to the presentation. I believe that it's going to be made available either online or as an email sent out later. But yes, please feel free to refer back to those URLs when you do get the slides. I also wanted to mention that all of the resources I shared that CDC has developed, all of our resources are free and can, in many cases, be ordered from the warehouse. In cases where the materials are not available in hard copy for order, all of our materials can be downloaded from our website, and you can print them off, make copies, distribute them to parents and people in your programs. There's no charge for the use of any CDC materials we've developed. So please feel comfortable using them in your work.
I just saw there was two questions that are somewhat related. One is somebody has a parent who wants to start at their daycare center who doesn't want to or doesn't vaccinate her child, and wanting to know if what steps there are, like should they refuse to admit the child. I would recommend that you talk with your state or local immunization program to find out what the requirements are for your particular state. And you can also talk to them a bit more about what they feel the risks may be locally, because we do see disease outbreaks vary by location sometimes, and so that would be important. And also you have to, be familiar with what the laws are. There may be laws in your state that mandate children to be vaccinated. So, you'll definitely want to check with your immunization program. And then another question was, as a daycare provider, wanting to know what they needed to be vaccinated for. And first, I would recommend that you check with your state immunization program again, because as Jenny mentioned, some states have certain requirements for daycare workers. There is also a link on the slide to the quiz for adults to find out what vaccines they may need, and you can check with that. So for example, if you live in California, as Jenny mentioned, daycare workers would be required to be vaccinated for measles, whooping cough, and flu.
Yeah, and that was a great, I'm glad you mentioned, Mark, about the fact that many states may have varying rules or guidelines or regulations around vaccination of children for entry into childcare. And then another thing I wanted to kind of build on your answer to share is we do get that question quite a bit about, what do I say to a parent who is adamantly opposed to vaccines? How can I convince them of the importance of protecting their child with vaccination according to the schedule? And I will say that I think there isn't no sort of magic answer that will appeal to all parents or respond to all parent concerns. But I did want to offer up a couple of suggestions on that front for how to handle that actual conversation with the parent. And I guess a couple of points. One is I would say, certainly go into the conversation with a feeling of empathy for the parent. I mean, the parents typically are concerned about vaccines because they may have heard something frightening or read something frightening online, and they're really just trying to make a decision that's going to be in the best interest of their child. They're motivated by a feeling of love and protection for their baby. So certainly approaching it in an open and understanding manner, I think, can really help the conversation go well. I would also recommend finding out what a parent's concerns are and suggesting that they discuss those with their child's healthcare provider. Often the child's doctor or nurse is able to speak directly to that particular child's health and medical background and allay a parent's fears and concerns by addressing the importance of vaccines for that particular child. And then the third thing I would suggest would be to try to emphasize to the parent the potential danger of these diseases that vaccines prevent. I think sometimes because, as Mark was alluding to earlier, a lot of parents are unfamiliar with many of these diseases, and so it's easy to become focused on what is the safety of the vaccines, and people lose sight of the fact that they are extremely safe, but the diseases they prevent are extremely dangerous and in many cases deadly. So I would say maybe focusing on, your concern for the child, wanting to make sure the baby is going to be safe from these serious diseases. We do have a number of fact sheets. CDC has, we've developed fact sheets on each of the diseases that the childhood vaccines prevent. They're designed for a parent audience. They're very straightforward and plain language, and they talk openly about the risks and benefits of immunizing babies. Talks about what is the disease, why is it serious, why do we need to prevent it with vaccines, and I would recommend that those might be helpful resources in those conversations as well. So I'm sorry, that's kind of a long answer, but I did want to kind of go over a few of those points because it is a question that we do hear quite frequently.
Yeah, I'm going through some more, and so that does come up quite a bit. So thank you, Jenny, for that discussion. Just a couple of things that I've picked up. There was a question whether or not there was a vaccination for ringworm, and I am not aware of a vaccination for ringworm. That is something that is unfortunately another kind of contagious condition that kids can spread to each other. But the best thing for that is for the parents to get their kids seen by their healthcare provider and to keep the child, if they're infected, out of the daycare setting. There was another question, again, asking about immunization information systems and how do you determine if your state will give you access. As Jenny mentioned, we recommend that you reach out to your state immunization program to find out if you can get access to these information systems or registries. There was a question there about the Synagus series, which is it's not a vaccine per se, but it's a way to help prevent respiratory syncytial virus, or RSV, which is another infectious disease that we can see. I am not super familiar with that, so I'd like to check with some folks here at CDC and get back to you on that one to make sure I give you all the most current information that we have. So I'll get back to you on that one. Let's see what else I got here.
I'm seeing a question here asking about, aside from required vaccinations, are there any that you would recommend to any childcare provider, regardless of their state's regulation? And I think that's a really great question because it kind of underscores something that's really important to keep in mind, which is that, states have different rules about what vaccines are required for childcare staff. And we would really recommend that for the best protection, both for the provider themselves and for the children they take care of, that those people should get all the recommended vaccines that they'd be required just as an adult of that particular age. I would say also, and the best way to find out about that would be to fill out the CDC adult vaccine quiz that we've talked about a few times here, because that will ask you some questions about your background, not only age, but also other health conditions, and based on that, make a recommendation or provide information you can discuss with your doctor about vaccines that might be right for you as an adult, and then of course those will be relevant in the child care setting. And I would say in addition to that, really, regardless of the state rules, I would say the minimum child care workers should really be vaccinated against flu, measles, and the whooping cough disease, which would be the Tdap vaccine.
So there is another question. I think, Jenny, you may have been addressing it, but I'll just sort of mention again, if you had certain vaccines as a child yourself and now you're a child care worker, which vaccines would you need to get? One thing, well, two things to look at for sure is one, what may be required by your state as a child care worker. So you would need to check with your state immunization program. And then also you can take the adult quiz that we've mentioned a few times to see which vaccines would be recommended for you. There's a question here about parents using the risk of autism from immunization. And unfortunately, that's one of those topics that just doesn't seem to go away. There's a lot of information and misinformation on the web about any links, but CDC's stance has been that the evidence does not support that. So you can say that CDC doesn't support that, but sometimes, as Jenny was saying, it can be tricky when you're dealing with people when they get information or they feel passionate in some way, and you certainly understand where they're coming from. They only want to do what's best for their children. So let's see.
I'm seeing a couple of questions asking about if the child care provider is themselves pregnant, what vaccines would be required. And we would recommend that all pregnant women, including those who are providing care to other children, receive the Tdap, which is a whooping cough vaccine, as well as the flu vaccine during pregnancy. There are also other vaccines that would be important for the woman to receive, but would not be safe to get while she's pregnant. So if someone is planning to become pregnant, they think they might want to get pregnant in the coming year, for example, it would probably be a good idea for them to fill out the adult vaccine quiz to figure out what they need or talk to their doctor about it. But for example, you know, it's important for child care providers to be vaccinated against measles, and we would recommend that a woman receive the measles vaccine before being pregnant, because getting measles when you're pregnant is actually very dangerous. And also the rubella vaccine is contained in the same vaccine. So I would say that if a provider's already pregnant, certainly Tdap, which is whooping cough, and flu, but there may be others to discuss with your doctor if you think you may be getting pregnant in the next coming months or year. I see a question here about, is it safe for a child who is not vaccinated for a religious belief to be enrolled in a childcare setting with children who are vaccinated? And that's a difficult question to answer, but it's certainly one that I know must come up quite a bit. You know, in general, having a child who is not vaccinated in a setting with vaccinated children, you know, having a child unvaccinated just poses a risk in general, because no vaccine is 100% effective. You know, of course, we would love if that were the case, but vaccines are very good, but no vaccine is 100% effective. So if a child who is not vaccinated is exposed to one of these very serious and very contagious diseases, and then comes to child care, maybe before they're showing symptoms, but they're already contagious, they could pass it on to other children in the child care setting who maybe the vaccine was not highly effective for that particular child, or maybe the child is too young to have received all of the doses of the vaccine against that disease. So, I mean, in general, we have seen places where there are outbreaks of vaccine-preventable diseases in childcare settings because the children are not fully vaccinated, or some children are not vaccinated. So, I mean, I would stop short of saying that, suggesting what your policy should be in that situation in terms of excluding children, but certainly it does pose an increased risk for outbreak in the childcare setting if not all the children are vaccinated.
Yeah, and also sort of on the counterpoint to that, up to a certain point, if a child is vaccinated, it does help somewhat protect children who may be too young to be vaccinated, or who have a medical condition which prevents them from being vaccinated, from getting ill if they're exposed. Not if they're exposed. And what I mean by that is if there's a child who's immunized, they should not get the vaccine, although, as Jenny just mentioned, they're not, you know, necessarily 100% effective, but it's less likely they'll get the illness, and so then it's less likely that they can pass that illness on to the unvaccinated, either too young child or child with a medical condition. So, you know, it does offer some, but again, it's a very touchy situation, and it's best to have the children vaccinated. There's a question here about, let me just make sure I'm reading it correctly here. If an adult gets shingles, can children get chickenpox if they've not received the chickenpox vaccine? Chickenpox is and shingles are both caused by a varicella virus, but they are sort of different in their mechanism of disease, where chickenpox is the first exposure, and that's generally what you'll see in young kids, whereas zoster or shingles is when the virus reactivates in the body, and so there is a potential for being contagious. So yes, you would not, that childcare worker, if they had shingles, should probably not come into work until their symptoms have resolved. All right. And then there was a couple of questions about vaccines being updated yearly. I'm assuming that this is for childcare workers. Do they need to have yearly vaccines? And the flu vaccine is an annual vaccine. You need to get a flu vaccine each and every flu season because the virus that's in circulation changes each year. And so the vaccine will change each year. And just because you're immunized 1 year from the flu doesn't mean that that vaccine will cover for the next flu season. However, measles and whooping cough vaccine, those you don't have to get repeated every year. Those you generally will have long-lasting immunity to those. So those would only be one time. There's a question here about, this one is real quick this time, a question about, is there a list of diseases that if a child has, I think outside of some of these vaccine preventable diseases as well, that the child should be sent home. And that's something that you would need to check with your state immunization program again, because it may vary by state. In general, though, I would say that if you have a child that's ill, it's best that they not come in until they've been cleared by their healthcare provider that they are no longer contagious to other children in the daycare setting.
I see another question here asking about spacing of vaccines, and I'll just read it out loud. It says, how long between immunizations is still considered safe for infants? For instance, I'm caring for a child that got his 2 and 4 month immunizations, but then waited until 7 months to receive his 6-month vaccination. And this is obviously a one specific situation, but I think it's a good example of kind of a larger question. Many of these vaccines are required at specific ages. They really all are. Some of them actually can be administered during a window of time. And I think in this particular case, a child waiting until 7 months to get a 6-month set of vaccines, that's probably fine. I mean, depending on kind of this child's exposure to disease, I mean, probably that child will be fine if they're in an environment where they're largely surrounded by other vaccinated people and children. We like for children to be vaccinated right on schedule, right during the recommended ages, but if someone slips a month or so, it's probably going to be okay. The real danger is when people start spreading out their shots beyond the windows of time when the vaccines are recommended. It becomes hard for people to keep up with the shots. It becomes difficult to keep track of which ones the child has gotten and which ones they haven't gotten yet. And it also means that the amount of time the child is not protected from that disease is longer. So they're more likely to get sick because they could be exposed to a disease during that time when they're not protected. But I think in this situation, 7 months versus 6 months is probably fine. But actually, I did want to mention something on those lines. We didn't get a specific question about it, but it's something that we hear a lot about from parents. You may hear from parents an interest in sort of spreading out shots or waiting a little bit to get shots, delaying their vaccine doses. And one thing that we always tell parents, and it might be helpful to share this message with them, is that in many cases, the recommended ages for receiving vaccines are not just a single point in time. In many cases, a lot of these vaccines can be administered over a period of a few different months. So if a parent doesn't want to get all of the 12-month vaccines all in the same visit, they are welcome to work with their provider and make a series of visits to their doctor over that month period to get, one shot at a time, if that's what they would like to do. There is flexibility built into the recommended schedule to allow parents and providers to give those vaccine doses when would be convenient and when the parent wants to, as long as they're within those recommended age ranges. That is perfectly acceptable.
There's a question here to the flu vaccine. What is the alternative? Depending on the type of reaction that we have to a vaccine, providers may or may not recommend that that person gets the vaccine again. If they have an anaphylactic or allergic reaction, then they would recommend that they not get that vaccine again. If they've only had something like a sore arm or some mild symptoms, like maybe a low-grade fever or a little lethargy, or just sort of feeling off for a day or so after a vaccination, those are not necessarily contraindications. With the flu vaccine, the vaccine does change each year, and so just because you reacted one year doesn't necessarily mean you will in a subsequent year. And then starting for the 2018-2019 or upcoming flu season, there is going to be the option of having the intranasal or flu mist vaccine, which is a little bit different. And as long as you are not pregnant and you are within the age range that's recommended for the flu mist, then that's something that you can consider as well. There was another question about timing of vaccines with series, and this one specifically is a child only got vaccinated at 18 months and only one series. Would they be considered up to date? Many of the vaccines that, just most of them require a series of 2 or up to 5 at times in order to get complete coverage. And so a single vaccine is not going to fulfill that requirement. If a child falls behind in their vaccines, we do have what we call a catch-up immunization schedule, which can give some vaccine booster doses at accelerated schedules to help them catch up. And then once they're caught up, go back onto the regular recommended schedule. That's something that the parent can discuss with their healthcare provider, with their pediatrician, on how they can get their child caught up. But most vaccines are going to need, their boosters in order for the child to be considered, fully covered or fully immunized.
Okay, Jenny and Mark, this is Nicole. I'm going to chime in. We're running over time, and I don't want people to think that they have to stay since the hour is over. But if maybe we want to answer just 1 or 2 more questions. We have a lot of questions that have come in, and so hopefully if we didn't get to your question, Jenny and Mark will get the transcript of all of this, and we can kind of put out a general, more FAQ in regards to the questions that have been sent in. Does that sound good, Jenny and Mark?
Yeah.
Great. Yeah, maybe each of us will take one more question. And I'm excited about all the interest in this topic, and we can certainly follow up later with more information. Mark, what were you about to say?
I was just going to say, yeah, I've got a couple that I'll follow up with that I don't have the materials to answer right away. A lot of the questions, there seem to be some themes, and I think that we've covered them somewhat, but we'll go through them and make sure that we get each and every one of those answered and get those out. I'm just trying to look through and see if there's any one of the topic that we didn't really cover.
I just see one other sort of theme, a couple of questions that we could suggest real quick about what to do in situations where a child is being enrolled and they only have an old immunization record, for example, a record from a year earlier, and whether that is acceptable or not. And I think largely that may depend on the age of the child. If this is a child who is age 2 or younger, there are a number of vaccine doses that are received during the ages of 0 to 24 months. And so a 12-month-old record would certainly not be able to give you the information you need about whether that child is up to date or not, because there'd be a number of doses they should have gotten during that missing year that you wouldn't know whether they got them or not. So I would say that if the child is under the age of 2, I would certainly request a more updated record to see if that child has in fact received all their vaccine doses that they should have received. As you get older, after the age of 4 to 6, there's a longer period of time before children are have their next recommended vaccine doses. So older children, a year-old record might not really be a problem if it shows they're up to date as of that time period. But I assume we're talking about younger children here, in which case I would say you probably want to go ahead and get the updated record. Okay, well, we can go ahead then and wrap up. It sounds like we've covered off on most of the major themes, and some of the more specific questions we weren't able to get to. We'd be happy to follow up with some more specific answers to questions that came in. So thank you very much for having us this evening and for your time and attention and interest in this topic.
All right, thanks for signing us off, Jenny, and thanks everybody. And again, you have our emails here on the slides as well, so feel free to send us any questions, and we'll get to answering the rest of these questions first thing tomorrow.
Thank you, Jenny and Mark, and thank you again, everyone, for attending. Just like they said, we'll hopefully get back to you on all of these questions. We'll also be sending out the recording to this webinar, so you can go back and watch it again as many times as you want. It'll also be posted to our YouTube channel, as well as all of the slides and the resources. And then you can also be looking out for your certificates that will be sent out. So give us about a week to get all of those emails out. And then if you don't receive it within a week, get in contact with us and we'll make sure you get taken care of. So thanks again so much, Mark and Jenny, and we'll let everyone go for the night. So everyone have a great evening.
Good night.
Good night, everyone.